Welcome back. It is May, as we said a couple of minutes ago, and it's the perfect opportunity for the women and men out there in the Valley to get screened for breast cancer, and making it easy for us to do that is South Texas Health System. We welcome once again Tom Castañeda with South Texas Health System to talk a little bit about these Mammo Monday initiatives. Something so important, as we've learned, 1 in 8 women in their lifetime will experience breast cancer. That's quite a few women.
That is
and
a lot
men
of women.
Also.
The average woman, their risk of breast cancer is 13%. So 1 in 8 women will have breast cancer in their lifetime. Yeah. This year alone, there will be 320,000 cases of breast cancer, new cases detected this year. And so that's why it's really important. So South Texas Health System has every year a program in May that we call Cinco de Mammo. So it's all about promoting the importance of early detection through mammograms, because mammograms are considered the gold standard when it comes to detecting breast cancer early. A mammogram can actually detect breast cancer up to about 2 years before it becomes a lump or something that you may feel or your doctor may feel during a clinical breast exam.
Wow, the wonders of technology. And as we've learned, early detection is the key. Why is it so important, especially for the women of the Valley, Tom?
Because breast cancer affects everyone, and what we're starting to see is that we're seeing it at younger ages. So we're starting to see women in their 30s with breast cancer. And so what we want to do is make sure that women are prioritizing their breast health. They're doing everything they can, to stay healthy. So eating well, exercising, maintaining a healthy weight, but also taking all of those preventative actions. So getting those mammograms, talking to your doctor at the age of 25 is what's recommended by the American College of Radiology. Wow. At 25 to start having those conversations about your risk factors for breast cancer and when you should actually start getting your mammograms. But most women, on average, if you're at average risk for breast cancer between the ages of 40 to 74, you should be getting a mammogram every year or every other year, depending on the recommendation of your doctor.
Wow, that's the guidelines have definitely changed, and that's why you guys are trying to make it easier. So talk to me about the Cinco de Mammo initiative. It's going to be every Monday. It's going to be a great price, right?
Yes, that's right. So what we have is we have our Mammo Mondays. So every Monday at a different facility at STHS, we will be offering special education, just basically some pamphlets and information that you can come and get. We also give a token for anyone who is having a breast exam that day. But then throughout the entire month of May, starting today through May 31st, we are offering cash price, a special cash price of $100 for a 2D mammogram and $155 for a 3D mammogram. So you're able to come anytime. All you have to do is call 388-2190 is the pre-registration line. Make an appointment, and you can come anytime during the month to get your mammogram. And because breast cancer is such a serious issue, you hear a lot about it in October, but we want to make sure that this is a year-round initiative for women to prioritize their breast health.
I love that you guys are making affordable, because if you think about it, $100 to $150 is not a lot to invest in your health and in your lifespan, because as you catch it earlier, like you said, there are better chances of surviving it. And it's great that you guys are doing this initiative.
Yeah,
so,
and if you have insurance, it is covered by insurance, but there are a lot of women, unfortunately, who don't have insurance in our community. And so we want to make sure that we make it as accessible as possible and as cost-effective as possible.
Yeah, if you think about it, it adds up to a couple of Starbucks. And, you know, sometimes we spend money easily on things that maybe are not going to be as lasting as preventative health care. Alrighty, Tom, thank you so much for being on the show once again. Such important initiatives that you always bring to us from South Texas Health System. So hopefully all the women and men out there can take advantage of this promotion. Thank you so much.